Fantastic. Thank you very much. And thank you, everyone, for your time and patience this morning. We're on the home run now, so lunch is soon upon us, but we're going to have one more presentation today. And it's going to be a presentation about rethinking clinical trial community engagement through end-to-end collaborative approach. And this is going to be a presentation from two people. So Shayla Wilson, Head of Community and Digital Engagement at Acclinate, our partners, and then Saper Shojai, Vice President of Design Solutions from Lightship. So we're really looking forward to this, and personally I'm looking forward to this. So I'd like to invite them both down to the front, and then welcome to the presentation. Thank you. And as always, if you've got any questions, then there's a microphone at the front, so save them till the end, and we'll allow some time for questions.
Hello, everyone.
Hi.
Has everyone
It's lunch, so we're keeping it pretty chill. Is that okay with y'all? Perfect.
Has everyone recovered from the Usher concert is the most important question of the day. So thank you for joining us. My name is Saper Shojai. I'm, as Ben mentioned, from Lightship. And today with Shayla, we're going to be talking to you about how we've rethought about community engagement and really using a collaborative approach between our two organizations to lead to more community engagement and patient engagement efforts to help with trials and really reaching underrepresented population. At Lightship, our focus is really placing the participants at the center of the research and creating more access and choice when it comes to taking part in clinical trials. And some of the ways we'll do that is through things like home visits and mobile research units, and we're firm believers in that by increasing access and choice when it comes to clinical trials, we can hopefully lead to more equitable participation when it comes to studies. We typically work with pharma partners, CRO partners, Acclinate, for example, in bringing clinical trials closer to patients, and we do that through several different manners that we've talked about, and really it's the collaboration that's important for us, working with the right partners and right groups to help us lead to a more successful outcome and reaching more underrepresented populations. So I'll hand off to Shayla to talk a little bit about, I forgot to change the slide. There we go. I'll hand off to Shayla to talk about Acclinate a little bit.
And just so you all know, I am not so conservative when it comes to presenting, and so there may be words on the slide, but it's completely on us to engage and entertain you all. So Saper mentioned what Lightship does, and I think the reason why this collaboration works is because we are mission aligned. In the same way that they put the patient at the center of everything, for us it's community. We are very community-centric. We take an effective trust model and essentially use that to continuously engage community time and time again. And we meet community exactly where they are. So what that looks like is it may be some rural city in the middle of Alabama where we are showing up at people's doors, leveraging relationships with city mayors, or it could be at the campus of an HBCU where we're engaging the Student Government Association and the college president to really introduce what clinical research is and to educate and empower communities of color. Next slide. And so Saper already mentioned that this collaboration works because of how we essentially deliver end-to-end care. I think the important thing to note is that Acclinate engages at the top of the participation funnel. So we do not consider ourselves a clinical research organization by any means, but we partner with individuals who might appear on paper like competitors, and Lightship is not that for us. It's a very good collaboration that works because we are here to educate and empower the community and essentially introduce them them to research opportunities, and that is where Lightship comes in to create that access potential.
Perfect. So when Lightship steps in, when we're working with groups like Acclinate, it's really about the outside context of the study, doing the early patient engagement to increase the awareness, as Acclinate mentioned, and then focusing for us on how do we drive, for lack of better words, our infrastructure closer to participants. I think we hear this example a lot of the time in presentations like this. Individuals live an hour away from a trial site. To be able to just drive there and commit yourself to, let's say, a 2-hour visit, you have to schedule time off from work, kids pick up, things like that. So it could be quite cumbersome to try to take part in a trial. And for us, it's really about making that process easier so we can reach more people. So things like our mobile research units really help drive, pun fully intended, into a neighborhood which has all the equipment and supplies you need, and it presents a really comfortable environment for people to come on board, learn about the trial, and decide if they want to take part. One thing we hear a lot of time on our units is, oh, it doesn't feel like a doctor's office. And that's, I think, what we're trying to show. This taking part in a trial isn't scary. It's a very welcoming environment. You can ask questions. We're there to really create a safe and trusting environment for you so you can be comfortable in taking part with us. And the work we do with Acclinate, it's definitely not surface level. It's not just for the purposes of the study. As Shayla mentioned, it's that end-to-end model, working pre- and post-study to also make sure patients are engaged and really taking control of taking part in a trial. So with that said, to talk about we've talked about some of the concepts, but really to put it into a real-world example, our two groups worked on a project for a preclinical Alzheimer's study looking to identify individuals with a special marker that could receive treatment. And really, our focus wasn't just on hitting the enrollment goals, but it was more about also reaching a diverse population, and a population that's representative of the condition we're looking at. A lot of the times we see with drugs that are approved, we don't necessarily enroll all of the same participants that are affected by that condition. So our focus with this was definitely making the participation process easier, engaging with the underrepresented groups, and really about that collaborative effort with Acclinate in reaching the right population. So I will hand off to Shayla to speak a little bit about that on-the-ground work.
Yeah, so I think the important thing for us is that we always meet community where they are. And so I know Sapir on the last slide talked about the mobile research unit, but for us, it's understanding the motives behind what it influences people to actually participate in clinical research. And what we know is from our early engagement, we can determine essentially if people are actually willing to participate and where we can find those individuals and continue to sustain that engagement with them. And so in this particular example, we were able to leverage our community partners, AARP, as well as some senior centers to find the right people in the right moment at the right time. And that's important, right? Because a lot of people can do all the digital outreach that you want, and you can reach 20 million people if you really wanted to, but the important thing is reaching that right person in the moment that they want to be reached and willing to participate in the study. And so through our efforts, we were able to not only educate and empower our community, but also essentially be a warm handoff for Sapir and Lightship to come in and say, hey, here's the study that's most relevant for you, and here's where you can go for this particular treatment. And so I think that's why this collaboration works so beautifully, because it literally is pulling people through that funnel right to where they need to be to participate.
Perfect. And those efforts definitely paid off in the results we saw within our recruitment efforts for this study. So initially, we were about a quarter of our participants were coming from underrepresented groups compared to the national average, which is a big jump. In terms of engagement with the leads we were able to engage with at the top of the funnel were also more diverse. 30% of our participants that expressed interest in taking part through community events, outreach efforts that we made throughout that study were also from underrepresented communities. And that's really the important piece for us, is how do we engage with individuals who don't necessarily know about clinical trials and have easy access to them, and really making that process easier for them. And overall, 20% of the Lightship and Acclinate kind of leads that we engage with were from a Black population, again, an underrepresented group, especially in an Alzheimer's study. So it was important for us to be able to reach to more diverse groups. And for us, as I mentioned, this is definitely, not we don't want to be transactional with the individuals we work with, and we don't want to, just come in for the sake of recruiting someone and then being done and out. So the work we do with Acclinate is really to make that sustained effort in the community to engage with individuals post and pre-study, to make it really a full circle kind of moment. So we don't feel like we're just using a community for recruitment purposes and then we're out. Then no one wants to feel like that. I will hand off to Shayla.
So we've talked about Alzheimer's, but I think it's important to also just talk about other therapeutic areas. In this particular case, at Acclinate, we were brought on to essentially engage BIPOC women and other birthing persons of childbearing age to essentially grow our maternal health insights. And so how we essentially did that is we created a sub-community within our Now Included platform, a community that was hyper-focused on this particular population, to understanding their needs, to understanding what their barriers to optimal health are, to understanding why, if at all, they would participate in research and would they be willing, and where they go for trusted resources. And to do that, we were able to partner with some of our community partners in this space. And so often we lean on those community partners. We like to call them activation points at Acclinate. And so essentially they are helping us to activate the communities that they already have influence in. And so through our Mommy Listening Tour, which was essentially a roadshow for our maternal health work, we were able to engage moms across the nation. Next slide, Sapir. And so there were a number of different insights we were able to collect along the way. I think the important thing to note is at Acclinate, we use our Now Included community as an omni-channel approach. And so we know for sure that we cannot just leverage digital ads to reach the people. We have to be boots on the ground. We also need to leverage those community influencers to invest in them and give them the resources that are needed to grow and engage their community in the way that we are trying to empower people towards better health, inclusive of clinical research. And so through our efforts, we were able to reach over 50,000 people with just educational materials about different ways for improving maternal health. And then we engaged about 10,000 of those people, and we were able to collect unique insights from over 100 women across the nation. And from our insights, we were able to go back to our sponsors and say, here's where women go for trusted resources. Here's where women are on that spectrum of being willing to participate. And surprisingly enough, almost half of them were willing to participate in clinical research. What we hear more often than not, it's not that people aren't willing to participate, especially people from Black backgrounds, is that they are never offered the opportunity. It's that they don't know where to go to participate. And so through our Now Included community, we're able to empower them to make those decisions on their own. We educate them about what it means to participate in the clinical research process, what it looks like, how to keep yourself and your baby healthy. Those are usually the top questions, right? And so understanding all of those insights needed to actually move the needle and move people through that participation funnel is super essential for the work that we do.
So the last case study we wanted to share with you is a hybrid cardiology study that our team worked on. And for this study, we were giving participants the choice to have some of their predetermined visits by the protocol in their home. And we were able to, because of this, really expand the radius of recruitment from the site and go much further to allow individuals who wouldn't necessarily want to drive in every week or every couple of weeks for every visit to the clinic to take part in this with the home visit option. We used several different channels for recruitment, digital, foot on the ground.
Boots on the
Boots
ground.
on the ground.
More than 1 foot.
Yes. And really engaging with the community to inform about the study in general and do some pre-screening events and things like that. And really from the onset, it was about reaching a population that the site wouldn't necessarily have access to if it were doing their traditional recruitment and traditional approach to the study. And if we look at the results, definitely shows that this process of home visits and more innovative approaches is something individuals are interested in. So as you can see, most of the participants that we recruited for the study through our model, we were about 20 miles out from the site. And from someone from Los Angeles, 20 miles could be an hour and a half drive. So depending on where you are, that's quite the time commitment just to drive to a visit. And with that, because patients also had the choice of opting in for those home visits, more of the patients that, about 90+% of the patients that we identified for this study opted in for that home visit option because, again, it made it easier for them to take part, and we were reaching individuals who did not want to drive in every week. And overall, about 20%, a little over 20% of the participants we recruited for this study were from, again, an underrepresented population, which, again, highlights the benefit of that community engagement piece and going out further from the site to recruit individuals that are not necessarily taking part usually. So all of this is really to show that how important we think collaboration is. Both, I think, us and speaking for Shayla here, I don't think we can do this on our own. I think it's the collaborative approach and making sure we're working with organizations that have similar goals in bringing trials closer to people, the community engagement piece, and really pulling in individuals into the process instead of that transactional model we talked about earlier on. And for us, it's through different things. It could be educational events on mobile research units, educational events at, health fairs and things that are happening in the community. One of the ways we've found a great way to engage with community members is to go to already scheduled events in the community. Weekend concert, some sort of an event that's happening in a park, and really going in there and informing someone, not even just about any specific study, but just general clinical trial education is so helpful for people who don't necessarily know what a clinical trial is and how you take part in it. And by having our staff there, our nurses and mobile research units and things like that, helps them walk through the process and see what participation will actually look like when they decide to take part in a study. And with that, working closely, again, with Acclinate around the community engagement piece.
Yeah, and Sapir was at every Beyonce show trying to understand how many people wanted to participate in research. Just kidding. So, I mean, the important thing here is really building trust early. And it's not fast, and so often I know our mindsets are, what's ROI, right? But if you're investing in communities, you are essentially building that trust and those relationships and nurturing it in a way that you can sustain engagement. So that ultimately, even though it's super top of the funnel, feeds into the attrition for your study and how people are able to come back and trust your brand and things like that. And so through partnerships, I mean, we know solving diversity in clinical research is not a small feat. We also know that we cannot do it alone. And so through mission-aligned partners like a Lightship and Acclinate, you're able to really see the end-to-end process through. And Sabir mentioned how we've been in community. I know he said concerts, but we also do other things like building community gardens and packing up things at food banks and really just showing our investment in community and what that looks like. And we have a video to show that come to life. That was my cue. There's a video.
Lightship and Acclinate are working together to overcome the barriers that prevent people of color from participating in clinical trials.
We're really doing something disruptive. So the current industry standard is to come to you and say, hey, you haven't met me before, but would you like to take part in the clinical trial? Most people are saying, I don't know, and for many groups from minority populations that already have a certain level of distrust in the medical industry, the answer is more like, hell no.
We do community engagement for our Now Included brand, where we educate and engage underserved and underrepresented communities. We provide them access to clinical trials along with additional research opportunities. This is all about relationships. This is about knowing who people are, what their needs are, and how you can best serve them.
If we're going to effectively engage our communities of color, we must do it from a standpoint of building trust before we go and ask them to take part in clinical trials.
Real-life interactions and early community engagement is essential to design and conduct clinical trials with patients at the center. Together, we are increasing access to clinical studies for patients everywhere and giving them the choice to participate.
This is an issue of educating, engaging, and empowering our communities of color so they can make informed decisions about clinical trial participation.
There's no better time for pharma to come in and build strong relationships with the communities of color. We are waiting on that, those relationships to be built with our communities.
Thank you. So in wrapping up, really I want to go back to that initial theme I mentioned. You know, our space is changing every day with new technologies and new approaches, and we can't solve all of the problems individually as individual companies. It's all about collaboration and teamwork, and there are enough, I think, problems for us to solve collectively together that I think there's no way we can do it without partnerships and collaboration. And you know, this is just one example of the work we do and using some of the case studies to show that collaboration and partnership really work. Community engagement is not just relevant, but also so necessary as we're engaging underrepresented groups and reaching out to new communities to take part in clinical trials. So as we've started hopefully solving some of these problems, hopefully other organizations can also step in and attack, I guess, these issues in a similar manner. And it's all about collaboration and teamwork for us and working with partners that can help pull in everyone who wants to take part in a clinical trial into the fold. With that said, I think we have a few more minutes for questions.
Yes. Questions. I think we have 10 minutes for questions. No pressure. Oh, sorry, I did binge shop.
Do you need the mic, man?
So just to get everyone started, I'll raise a question and then I'll ask the audience if they have any. So with the different lenses from Acclimate and Lightship, what do you both think is the biggest challenge in building engagement of communities all the way through from the journey of initial engagement through to enrollment in the trial?
So I will answer that question from two sides because I am the head of community, so I'm always thinking of community first. I think the biggest challenge is there's still a lot of mistrust and education we have to do on the community side. Oftentimes when people think about pharmaceutical companies or research, they think, and not even to go historical, they think what happened to me yesterday at my doctor's office, my doctor's not listening to me, and I had a cousin who almost died on the table because no one listens to their concerns, right? And they're just trying to get my money and I don't want to take medicines, right? So like really helping our community see that you are invested in their health, their wealth, and their well-being is super critical and probably one of the biggest challenges we have to overcome. From a pharma healthcare industry side, I believe the biggest challenge is ROI. So a lot of times the question, and I don't know how many of you were at the award ceremony yesterday, but Tiffany got this question live on stage. Literally, how many people are you moving through the funnel? And it's like, sure, you're literally looking for one or two people, and we are constantly trying to over-educate and empower way more than one or two people that you're looking for. And so it's not even about who comes through the funnel, it's about what you're doing at the top.
I think Shayla's answer really covers most of it. I think the other piece I would add to kind of build on that is really the communication piece and keeping your promise, even something as simple as, when we're doing an event, where we're going to be and the timing and things like that. If things are going to change, making sure we communicate, because that comes back to us. We said we were going to be here somewhere, we weren't. I'm not interested anymore in taking part or working with you. I can't trust what you say. So the trust really starts early, and it's even in the smallest things as just being where you say you are or engaging in the appropriate manner. So I think all of those things are challenges we see and we hopefully try to avoid and solution for some of them.
Thank you.
Any other questions?
Any more from the audience? Please come up.
Hey, y'all, thank you so much for the presentation. I came in late. My name is Keontae Key. I love what you all are doing from the community side. Definitely need it. We want to make sure we are building on trust. This is, I guess, an issue I have personally, that we educate our communities and then they show up to the doctor's offices who have not been educated or gotten that engagement. So how do we kind of bring those investigators, those researchers, those doctors along so that when a patient does come to ask about a clinical trial, they're not like, oh, you won't qualify, but they'll actually have a conversation with them to be able to really scale what y'all are trying to do in terms of, you said ROI, maybe like return on inclusion. So thank you.
It's a great question. The biggest thing for us at Acclimate is we engage all the people in community, and that is the sites. And so we do a bit of site engagement in a way that, one, asks them where they see gaps, right? Because they are the people that are working in the community day to day. Two, what the community needs from their perspective. How many people are coming through their door that may or may not look like our community. So all of these things are important for us to build relationships. I talked about building relationships in community, but like on an individual level, we at Acclimate are relationship builders across the ecosystem. And so for us, building relationships with sites to better understand how they are interacting with our communities is super important so that we can help them to be prepared for our community coming in. We also do warm handoffs for that very reason.
I think to add on to that similar scenario, we work with a lot of trial naive investigators sometimes, and one of our initiatives for this next year is to really be able to bring on trial naive investigators and help them with not only just infrastructure, but the training and the cultural training and all of it, so they're comfortable in working on a study. And I think that's the biggest part of this, having a investigator population that represents the population getting enrolled into the study. I think we've seen a lot of data on how well that works in a clinical setting, and that's, I think, something we have to look at more in a research setting as well to make sure that the investigators are closely representative of the population we're trying to enroll in the study. But great question. Thank you. I think there was one more.
I was actually the last fall, so.
Oh, hi. You're kind.
Rita Ector from Evernorth Health Services.
Oh.
One of the things we're super passionate about is being able to get not just equal access to our communities of color, but also the other diverse population, which is oftentimes our elderly, who I imagine benefit greatly from a mobile unit, especially in Alzheimer's, but also in things like oncology, where they haven't been represented. So my question to you is, how do you address some of that access when digital is not really the best approach because they're scared of it? And then on the other part of it, the accessibility, because they're homebound and their caregivers are actually their access.
Great question. I can start us off for that one. So that's definitely something we've looked at on some of our studies. And as you mentioned, technology is not always the solution. We can be as high tech as we want, but I think in those instances, it's also about the human touch aspect of it and making sure it's a high touch scenario. So a lot of the times when we do have that elderly population on one of our studies, our research coordinators become a little bit of tech help, IT support, and even something as simple as helping an individual be able to connect on the device to their home Wi-Fi. So things like that, making sure we build in time and training for our staff so they're comfortable. And the other piece of it, in terms of, I think, the engagement piece, is working, for us at least, working with senior living facilities, areas where there's a large population of seniors, and going there and doing education and awareness outside of the study, as I mentioned, to build that support and that engagement and the trust to then hopefully engage with them for the study.
Yeah, so just to piggyback off of that last part, a lot of our partners are, as I mentioned, embedded in the community. And so even as simple as we have an event happening in April at a senior living center, and we talk to the head of that living center and say, when are people most likely to be there and active, and when are they most likely to engage, right? So really like honing in on that, meeting people where they are. The other thing I think that we often forget is that the healthcare ecosystem is very intergenerational. And so in some aspects, I may have a grandmother who is not on any social media and won't see an ad or whatever the case may be, but she has a daughter who is the primary caretaker, a granddaughter who is also looking at things for her because she's interested in the care of her grandmother. We also are not above warm touches. Like, I love a good phone call. I love a good postcard. And so whatever it is to really get people engaged, we will do that because we understand everyone's needs are different.
Great question. Thank you.
Last time, or last minute for a question, otherwise we can draw it to a close. I think everyone's keen for lunch. So I wanted to say thank you, Shayla, thank you, Sapir, for the presentation, and thank you, everyone, for the time today. It's been excellent being here for this part of the presentation, and really looking forward to the rest of the conference and learning more and meeting many people. So thanks, everyone, for the time, and have a good rest of the day.
Thank you.
Thank you, Ben. And yes, thank you, everyone. That was a great morning in our outsourcing track here. Please use this hour time of break to continue the networking and conversation. Take a visit down in our exhibit hall. We're offering some coffee and desserts down there, so you can refuel up, get a cup of coffee, and get ready for our afternoon sessions. Outsourcing is going to start right back here at 2:20. Thanks, everyone.